We have with us Dr. Jerry Cochran from the University of Utah. He's going to go over this presentation. And Dr. Cochran, I don't know, are you able to present or do you want me to present your PowerPoint?
Yeah, I can share. Thank you.
Okay, perfect.
If it doesn't work though,
I'll
I'll
be ready
ask.
just in case.
Exactly. Let me see if I've got it queued up appropriately here. Let me see here. How does that look? Is it showing in presenter mode?
No, it is. Yes.
Awesome. Okay, awesome. Let me just move some stuff around. Okay. Um, my name is Jerry Cochran. I'm a faculty member in the School of Medicine at the University of Utah. I also am the interim director for the Center for Medical Cannabis Research, as well as I work with a group called the Medical Cannabis Outcomes Research and Evaluation Center at the University of Utah. And we were approached maybe a year ago, no, about a year and a half ago, about helping out this year with the state's market analysis survey. I think the Utah Department of Agriculture is required to do a market analysis survey every year, kind of assessing if the program is meeting needs of individuals who are participating, and also the purpose of the survey is to figure out if it's what are the barriers for individuals who are not participating. So I'll just jump into it right now. So this is kind of the results of that report. I will say it's a very high level summary. As I mentioned, this was done in partnership under a contract with Utah Department of Health and Human Services and the Department of Agriculture. My group has other grants from the NIH, the CDC, and private foundations, but we don't really have any other like industry ties or anything like that, or industry sponsoring. So I'm just going to give you a little overview here of what the presentation is going to encompass today. So I'm going to give you just a little bit of background on the context of the survey. We're going to spend some time on the method so we can all understand kind of where where the data is coming from and how it was collected. I'm just gonna go over some high level results. There's quite a bit of data. I think the final report was like, I don't know, maybe like 50 pages. It was pretty lengthy. So we just kind of selected some things that seemed relevant, as well as some themes, and then we'll do some key discussions and takeaways. And then at the end, we have some Q&A if anybody wants to ask some questions. So background. So you guys know all these things. Really we all know when the program was established, there's probably around 100,000 patients. There's quite a bit of cannabis sales in the state every year. And as I mentioned, the purpose of this survey is really to understand the patient experience and to make sure that the program is meeting the needs of the patients. And what I really think is interesting, as I mentioned before, is the fact that it's not only the patients in the program, but individuals outside of the program. And you'll see kind of as I go through the methods, how we try to be very thoughtful and thorough about those who we reached out to get their thoughts and opinions about the program. So the methods of it. So this was a cross-sectional study, meaning that it was just like a one-time survey sent out. It's not longitudinal, so we can't measure changes over time. It's just kind of a snapshot in time. Really, the purpose to evaluate patient engagement satisfaction with the program. We administer the survey using the Qualtrics platform. Many people are familiar with that. So, homegrown service out of Utah County. They have a really nice platform. It's really patient friendly and easy to use. We administered the survey for about 2 months, a little less than 2 months, just in November to December. So the data is very new. Because of the way we designed it to be an anonymous survey, meaning that we didn't collect patient identifiers or things that would potentially put people at risk for being identified as a participant in the survey. So it was designated as exempt by the IRB. There are pros and cons to those types of surveys. The pros, though, are people feel much more comfortable participating in anonymous surveys. And people who participated were able to, at the end of the survey, put their name in a raffle, and then we gave a few gift cards away at the end to try to enhance participation. So who did we reach out to? So this was primarily focused on adults above 18. If you survey children, it becomes a much more high risk survey. So it was adults, and it could also be caregivers for people. But when they answered the survey, they were supposed to answer not for themselves, obviously, but for the person that they were taking. If they were a caregiver, they were to answer the survey as if, you know, the questions were being answered by the person. So this was a convenient sample survey, meaning that it was not it was just people who were available. So we identified some sources of that we wanted to reach out to, and then those individuals, if they wanted to participate, they participated. So those sources, so for the people who were current cardholders or expired cardholders, we worked with the Utah Center for Medical Cannabis. And then for patients who did not have medical cannabis cards, but who had qualifying conditions, we utilized the University of Utah medical record to be able to identify. So basically finding ICD-10 codes based on qualifying conditions. We culled out around 100,000 people from the health system. And these people, it was statewide. It is obviously concentrated in Salt Lake County, but they are, you know, across the state. We did have representation across the state, even though it wasn't super large. So anyways, we sent about 250,000 emails out. But we also made the decision to do advertising in medical cannabis pharmacies. So we sent a recruitment material to these locations. Oh, and I already mentioned the raffle. So I will make this point because you might be thinking this. So because of that last bullet point, we were asked to, you know, recruit in the pharmacies. We cannot calculate an actual response rate to the survey. So that's just that was a decision to enhance the sample size. But when we did that, you cannot calculate the because we don't know how many people were contacted. So it's just one point there. So we surveyed active cardholders, expired cardholders, non-registered cannabis users. So people who self-identified as using cannabis but were not in the program, and then people who had qualifying conditions who were not using cannabis, who would be potentially eligible for the program. The survey was specifically developed in partnership with the Department of Health and Agriculture. We really wanted to make sure that it, you know, answered the questions that they felt like they were kind of legislatively, you know, mandated to do. But we also took our questions to a number of different community groups, provider groups, and also had patients look at it to make sure not only we're answering the right questions, asking the right questions, but then we were also asking them in the right way, because that's obviously super important. So we asked about medical conditions, cannabis use, program experience, satisfaction and barriers, perception of laws, a number of different topics. And then it was, as I mentioned, it was collected in Qualtrics. We cleaned it when we pulled it out of Qualtrics. We cleaned the data, and then we basically just very basically provided frequencies and percentage and means, like means and standard deviations. So results. So we have a total response of 14,600 patients, which we felt good about. We felt like we got a nice representation of individuals. You can see the breakdown of the different groups here. The smallest group were that non-registered, individuals who are using cannabis were not registered in the program. But we did have a nice kind of representation from across the groups. The active cardholders obviously were the largest group who responded. Kind of across all the samples, they're about 47 years old was the average age. For those who were using cannabis, the non-cannabis, they were just a little bit older at 51. Most people had health insurance, and most people had more than a high school education, which, as you're probably thinking, means the people who responded are a little bit more affluent, right? So just think about, potential biases in the responses. Um, so so that's just an important thing, who the population was. You can see here the different conditions reported by individuals. We actually asked a huge list of potential conditions. Uh, but these were kind of the top, the top ones that people indicated that they were experiencing. So for active card holders, the most people are using cannabis every day, um, or just a few times during the week. Um, most people had experienced actually making a purchase at a cannabis dispensary. But interestingly enough, in the active cardholder group, that 17% of people who they were doing some shopping outside of the state, which we all know is a thing that people do. And I think you'll see as we go more into the details, you'll probably see some of those. As I should say, as we get more into the slides, you'll see potentially why some people are going out of state. So again, with active cardholders, um, close to half said that the pharmacies are accessible. Um, that strongly agree. And then the individuals who just agree, about 37%. So most people are feeling good about the access. And then almost 3/4 of individuals were able to get those products they preferred. And you can see here that the products, they feel like they're really high quality at the different pharmacies. Um, you're going to see here again in these cost barriers. So about a third of the patients are saying that the product price is a barrier sometimes. And individuals also are saying that only about 10% of individuals saying that the product price is not an issue for them. So now moving on to expired card holders. We're gonna again see this theme here. About 40% did not renew because of price of the products. About a third indicated that it was the cost of the visit to the provider that was impeding them. 16%, well, that's not a ton of people. It's still, I would say, non-trivial, that they felt like the process was too complex. And then 14% had some concerns about legal issues. But of all these people who are still not, who had not renewed, about 41% are still using cannabis medically. Meaning, and it's important that we did specifically ask patients about cannabis use for medical reasons, and that's important wording that we were very interested in trying to understand. There's medical cannabis use where they have a prescription, and then there's cannabis use for medical reasons, and that, as I just said, about 40% of people are using cannabis for medical reasons, but they don't have a card. Okay, so expired cold holders, so some legal and policy constraints. So they did say that some product restrictions, about a third, were potential impediments to them renewing. This is an interesting about transporting across state lines. About a third of people indicated that was an issue. Smoking cannabis, about a third of people. Limits on number of pharmacies. They said a third of people, which, you wonder, most people felt like the pharmacies were accessible, that were in the active program, the active card holders. These folks, about a third of them who have the expired, are saying that they weren't close enough, or they weren't accessible. So you think, okay, people who are using this is probably obvious, but people who are using the pharmacies, obviously they're accessible. People who are letting the certifications go and things, or their cards go, are not able to access the pharmacies. And then this home cultivation was an issue that came up as well with about a third of patients. So non-registered cannabis users, so people, medical use, or cannabis use for medical reasons, but who do not have cards. um, cost, and about 20% of these, 21% of these individuals, they said they didn't know much about the program or they didn't have information about the program. Um, Again, cost is in there, and then there are some concerns about privacy, about being a part of the program, and then as well complexity of the program. About 17% said that that was a barrier. So the qualifying conditions. So these are people who have the qualifying conditions, no cannabis use. So 40% of the people saying they just were not aware that the program existed, which seems like a really easy barrier, to let people know. They weren't sure if the cannabis product would help their condition. Some just were not interested in using cannabis, and then they were concerned about, and others, let me see, I can't see because the about 21%, they were concerned about what the physiological ramifications would be. The cross group findings, meaning this is kind of like some stuff that we're seeing across the groups. You get, as we said, cost, right? It just came up again and again. Awareness of the program seemed like it was an issue. And there's this process, this we call it program leakage, meaning people, who are part of the program, who are, have the card, but they were going to other sources to get their products, meaning like out of state, and then high status. And then, when they were participating in the program, they were satisfied with it. So it seems like there might be a little bit of a selection bias into the program about people who are able to successfully engage and continue. So we have, most cannabis most people who have medical cards are using it regularly, high satisfaction. Majority are purchasing from Utah cannabis pharmacies, but again, the barriers of cost are affecting a lot of the individuals. So, potential policy implications, and I think there's been some changes this year. Cost is being addressed. It seems like awareness. I see, most of the advertising is probably that we see around is probably billboards from the pharmacies, but maybe there's additional things that can be done by the state to improve awareness. It seems like program complexity is an issue, and it's so awesome that the legislative updates that we heard are really targeting that. So we're well ahead of the curve in that respect. And then, it seems like, enhancing provider engagement with patients who are, maybe using outside of the program, or I don't know. It seems like those patients who are using cannabis outside of the program need to be engaged, and maybe more education or information would be helpful to them. So anyway, if you're interested in, if you've been enjoying this presentation and you want more of this kind of research, come next week to our annual Center for Medical Cannabis Research Symposium. There's a little QR code there if you want to scan it, or email me directly. We have some national experts coming to talk about, it's kind of bench to bedside is the theme. So we'd love to have anybody participate who would like to. I know we have many representatives from the state who come, which is amazing. And so yeah, everybody's welcome to attend. It's free. We provide lunch, and really great opportunity for learning. It really is. I shouldn't say bench to bedside. It is from the agriculture to bedside. So anyway, with that, I'll wrap up here and answer any questions that people might have.
I'll give people a minute to type in any questions that they have. Go ahead and use either the chat or the QA. We're watching both of them to ask your questions. Love to hear from you what you thought, what you were excited about, what is working. You guys let us know. And the QR code, Sarah Dash, do you have the ability to put that in the chat for everybody for that symposium?
How about this? They're saying that the registration is closed. Yeah, I think it just closed maybe last week or earlier this week. Let me put some contact information in the chat for Valerie Ahananu, and she can take care of you if you want to come. So I'll put that in the chat. She's the kind of the program manager there.
Somebody also just asked if the symposium is virtual or is it just in person?
Primarily it is in person. Yeah, trying to do it. We thought about doing it virtually, but we're always afraid that people won't come, just be in a big room by ourselves. So yeah.
Great.
Anyway, awesome.
And
Actually,
as you guys are,
Sarah, you had commented, Sarah Dash, you had commented earlier that maybe people weren't. Can you have Valerie's email, don't you, Sarah?
Yep, yeah, I can add that in.
Yeah, can you put that in there and
Sure.
just have people email her and say, I'd love to do a late registration.
great.
Thanks, guys. Oh,
Thank you.
perfect.
There it
Thank
is.
you. And hey, everybody, if you have other questions or whatever, or you want to just talk about, the results here or results of our other work that we've been doing with the state, with regard to research and evaluation, please just reach out. We're here. We'd love to talk. And uh, the best ideas about things to evaluate, the things to research come from the field. So, you know, please help us figure out what are the questions need to be answered.
And then from us at Center for Medical Cannabis, we have been looking deeply into that report. We love it. And we're just kind of looking, kind of like the laws of what we can implement and, looking at if there's possibilities for education and maybe potential statute changes being requested or, policies, whatever needs. So we're working through that. Again, if you have any suggestions, we always love to hear that. But just know we are also excited about this and wanting to make changes to make the program better as always.
Yeah, it's so awesome that you guys are. I've talked with other states who are not as invested in this evaluative process, and people aren't satisfied with the programs, when there's not this feedback and this dynamic and this evolution. So, oh, thanks, Rich. Appreciate it. Yeah. Anyway, thanks, everybody. Free to contact me, and hopefully we'll see you at the symposium. If not, maybe some other time.